My name is Hardeep. I work at 3 East here at Adventist and Rideout. Not necessarily as the first field I thought about, but when I was in high school, I had a friend of mine who was like, "Oh, what do you want to do after? What do you want to go for college?" And I kind of was like, "I'm not sure," but I knew one thing is I liked about it is we interact with such different types of people. We have people from all backgrounds, different life stories, and it's kind of been incredible to meet all of them and learn about their stories. So I love interacting with people. I love the way nursing lets us meet new people every day. So it's been incredible. I think my biggest skill, when it comes to nursing is probably communication and being able to advocate for our patients. You know, we have a lot of patients that come in and they come in very vulnerable because, you know, they came from being able to do everything themselves and now they're in a position where they have to rely on us or other team members to kind of help them with their health. And so I think communication, letting the patient feel like they have control of what they're going through, and then, you know, even though it necessarily might not even be in our control, but just a feeling of control where they're able to feel like they're taking part in their health care, and it's just not, you know, you're not just handing them some pills and be like, here you go. But they're actually knowing what they're getting, what the plan is, and hopefully, you know, being able to get discharged and knowing what they went through and that they came out better. So there is a patient that I remember, she came in and, you know, this is somebody that never had any medical problems, didn't take any medications at home, and all of a sudden she was requiring oxygen, she was requiring having a chest tube put in, and after a couple of days, you know, they did repeat chest x-rays to see if the chest tube could come out, and it just seemed like the situation kept getting worse. And I had this patient over multiple days, and, you know, when you're interacting with a patient for 12 hours a day, you know, they're no longer, you know, a stranger to you, they're more like a friend, they're more like a family member in the hospital. So this particular patient, she was starting to lose hope after a couple of days of the same story. But, you know, I spent a lot of hours in there talking to her and just kind of getting her mind off of what was going on. And I was very happy to see, you know, over a couple of days that when I had a few days off and I came back and her situation was much better, and just that smile on her face to see me, knowing that she, you know, went through that hard time and we went through it together, and now, you know, she's that one step closer to leaving the hospital and going back to somewhat of a normal life. So we were offered the vaccine in, I think, late December, and at the time, like many others, I was uncertain about it. It was something new, you know, people had questions, and I spoke to one of our case managers we have on the floor, who is a good friend of mine, and I was like, "Oh, I don't know if I'm gonna get it." And he told me, "Hey, if this is a solution that lets us go back to our normal life, I'm willing to take that risk and take it and just see how it goes." So he really convinced me to, you know, it's uncertain, but I took it and I'm glad I did. It's letting us make that one step closer to going back to pre-COVID, and I'm really glad that, you know, a large part of our community here has taken the vaccine and that we're all moving towards going back to our normal life, hopefully relatively soon.